You know, shoulder pain, it's one of those things, right? It can creep up on you slowly or bam, it hits you all at once. And either way, it is just incredibly frustrating. Today, we're going to get to the bottom of one of the most common causes, the rotator cuff.
So let's kick things off with a question that's kind of fascinating when you think about it. Why is the most flexible joint in your body, the one that lets you throw a ball, reach for that top shelf, do pretty much anything, why is it also one of the most vulnerable to injury? That is the paradox we're digging into today.
All right, Section 1, your amazing, vulnerable shoulder. Let's dive right into the shoulder itself. It's a truly amazing piece of natural engineering, but it has this built-in vulnerability. And the secret is that its greatest strength, that incredible mobility, well, that's also its Achilles heel.
So what is this rotator cuff we hear so much about? Well, picture this. It's like a dedicated team of 4 muscles and their tendons. And their whole job, their entire purpose, is to literally hug the top of your arm bone, keeping it snug and secure right there in the shoulder socket. This little team of stabilizers is what makes all that incredible movement possible in the first place.
Okay, so if the rotator cuff is our little stabilizing team, what happens when things go wrong, when one of them gets benched? Let's get into the common culprits that cause all that shoulder pain.
First up, and this is a big one, are rotator cuff tears. These can happen all of a sudden, like from a fall, or they can just be that slow, gradual wear and tear over many years. But it's not always a tear. The pain could be from tendonitis or bursitis. That's inflammation from doing something repetitive, like painting a ceiling all day. Or it could be something called impingement, where the tendons are literally getting pinched. It might even be instability from an old dislocation or just plain old arthritis. The main thing to get is that shoulder pain can wear a lot of different hats.
Okay, so you've got this nagging shoulder pain. But how do you know when it's just, I slept on it wrong pain versus, I really need to see a doctor pain? Let's look at the key signs that tell you it's time to stop just toughing it out and go get a professional opinion.
Okay, listen up, because these are the real red flags. If that pain just won't quit, especially the kind of pain that wakes you up in the middle of the night, that's a big one. Or weakness, when you try to lift your arm and it just feels weak. If your shoulder feels stiff and you just can't move it like you used to, or you feel a weird popping or cracking sensation. And critically, if the pain just isn't getting any better with rest, these are all your body's way of screaming, hey, go see a doctor.
And this is where we turn a corner, because there is good news. Once you do get help, there is a clear, structured approach to getting you back to feeling good. Let's talk about your path to recovery.
So the whole journey kicks off with getting a really accurate diagnosis, often using an MRI or an ultrasound to get a crystal clear picture of what's going on. From there, the first line of defense is almost always non-surgical. We're talking physiotherapy, medication, maybe some injections. Now, if that isn't enough to fix the problem, then advanced surgical options come into play. But no matter which path you take, the journey always ends with structured rehab to get that strength and stability back. It's a very clear, step-by-step process.
But hang on a second. I want to pause here, because I know what you're thinking the second you hear the word tear. You're thinking surgery, right? So do all tears actually need to be surgically repaired?
And the answer, thankfully, is a big, resounding no. Seriously, a lot of those smaller or partial tears can get so much better with non-surgical care, like a good physical therapy program. Surgery is an amazing tool for sure, but it is definitely not the only tool in the toolbox.
Now, let's say surgery is on the table. You've basically got 2 main routes. On one hand, there's arthroscopic repair. This is minimally invasive. They use tiny incisions and a little camera, and it usually means a quicker recovery. On the other hand, you've got the more traditional open repair, which might be necessary for bigger, more complicated tears where the surgeon really needs to get in there and have direct access. The right choice just totally depends on your specific injury.
Which of course brings up another really important question. What if you just don't do anything? What happens if you just try to ignore a tear and hope it goes away? Yeah, long story short, it's not a good idea to ignore it. What happens is those untreated tears can actually get worse over time. A problem that might be pretty manageable right now could turn into chronic pain, serious weakness, and even cause the joint to start degenerating. And that's exactly why getting it checked out early is so important. Okay, so we've talked diagnosis, we've talked treatment, but what about after? Let's get into the final and maybe most important section, staying strong and pain-free for the long haul.
First things first, let's talk about a realistic timeline, because this is super important. If surgery was part of your journey, you're generally looking at about 3 to 6 months for rehabilitation. It's a marathon, not a sprint, and you got to be committed to it.
So what does that commitment actually look like in practice? Well, a real, lasting recovery isn't just about letting things heal. It's about actively rebuilding. That means sticking to your physiotherapy program to get back your strength, your flexibility, and that all-important stability. See, the real goal isn't just to fix the problem you have now, but to learn the strategies and exercises to lower the risk of it ever happening again.
And that really brings us to the final, most hopeful point of all this. Shoulder pain can feel so limiting, I know, but it does not have to be a life sentence. The key thing to remember is this: with proper care, lasting recovery is possible. It's all about understanding the problem, getting the right help, and then committing to the process. So the real question is, are you ready to take that first step?